Welcome to Chennai International Centre's own podcast channel. Chennai International Centre is an intellectual platform for diversified discussions of public interest. With 5 years of meaningful work, curated panels and design programs, we've had the privilege of hosting many speakers of both national and international repute. Welcome to Chennai International Centre's podcast series on COVID-19 second wave. This is a series where Dr. Jayaprakash Muliyil, India's top epidemiologist, will answer some of your questions so you can stay informed and protect yourself and your loved ones during these testing times. Dr. Muliyil, let's begin with where we are right now. What explains this sudden surge? A question that almost everyone has is, what did we do right first and where did we go wrong later? Our listeners would like to know what caused the situation to get out of control.
Thank you. I think I'll start from a slightly different angle. What made the cases come down in the first place? Around September, this fall started. And I remember one of the interviewers asking me, listen, for the last 2-3 weeks, it's been falling. Don't you think it is, we are end of the line is near? And I hesitated to answer. And I said, I need some more time to look at the data because there's something bothering me. And what is bothering me was that I had anticipated that the herd immunity should be at a particular level in the country as a whole. Urban area, you need a little higher level. Rural area, lower level. But on an average, it should be just about 50%. But the ICMR survey showed only 25%. So that was not consistent with the fact that the herd immunity is bringing down the whole epidemic. But the fall was so tantalizing, and there were models which explain why this could happen. As a consequence, I also became quite excited. It went on for 4-5 months of fall, and then whole hell broke loose. What happened is, in a viral epidemic, the only thing that can put brakes is human immunity. There's nothing else we can do. We can produce some sort of flattening of the curve by behaving cautiously. But I must say that a certain proportion of the Indians did this job pretty well. And they were invisible to the virus. So actually, when the virus was looking at India, the population was very small because many of the middle class, upper middle class, well-to-do was staying safe, protecting themselves. And consequently, the epidemic started falling. Now, mortality came down. Everything was looking hunky-dory. And it's only natural our defenses come down a bit. And vaccine was on the horizon. And then the collective behavior of certain groups relaxed a bit in the context of COVID transmission dynamic. Now remember, when the transmission restarts, initially you won't see anything. And suddenly, when you enter into the exponential phase only, you know we are in trouble. And we are in the exponential phase. Now, when you look at it very carefully, that you realize one thing, that it is mostly the previously uninfected who are getting this infected. So what has happened then, even though you call it first wave, second wave, whatever it is the interrupted wave because of people's the way they behave, carefully avoiding the virus, that led us to that fall. But when that defenses came down, I think we were caught unaware. Now, that is a simplistic explanation, We'll come to the other factors later on. But also this was reflected in the way we as a collective group, our administration, our election efforts, our worship, all of them kind of worked along in the same guideline. As a consequence, we actually created a very, really difficult situation. I think all of us are responsible. And mind you, this is something that we could have avoided had we been careful enough. Maybe people like us should have been able to warn you because we haven't reached the herd immunity. But the fall was so consistent, maybe to become a harbinger of bad news is, most of us will be reluctant. Anyway, that is the phase now. And I think remember this thing that every time a person is infected, the most of the people come out safe. You can't forget about that. They are having immunity which is lasting. You go back to Dharavi's story, where naturally the disease came down. There are no cases even today. No new cases. So the immunity holds good. There's no doubt about it. So to the question that you asked, I must summarize that we had a gap in the immunity which would have stopped the epidemic. We could have corrected the gap through vaccination alone, but we didn't have the time to do that. So as a consequence, the virus could sneak in and produce an exacerbation of cases.
So what are the best and swift practices that you think we can adopt given the limited resources and time?
I think we should remind ourselves that the ability to control the infection for oneself remains in individual's hand. So the protection of oneself, wearing masks, keeping a distance, and being hygienically careful, they still remain the strong maneuvers to prevent infection from getting on to you. And people have practiced it. They know it. In fact, they were quite surprised that they got infected despite all their effort. But that's what happened when a balloon, in which you live safely, gets ruptured by a few people bringing the infection. Anyway, so that has to do on. But the present crisis seems to be quite a lot of a management issue in terms of lack of oxygen supply and things like that. So I think that is sad, okay? And many of the behavior, you will agree, were actually aiding the epidemic. Instead of flattening, we are creating a spike in the curve. So that was a kind of an unfortunate situation. So I see the people say, okay, let's lock down. Now, what do you mean by lockdown? Keep everybody at home. Is that what it is? Lockdown comes with its own price. We have learned it earlier, and now there is a lot of evidence the harm it has caused. We have to go into personal protection at personal level, and that will make a difference. It's very difficult for virus to come into you if you are careful. So that lesson has to be reinforced instead of, paralyzing everybody. Remember, by now, a large number of people have already been infected with it. Now remember, today when you say there are 300,000 cases occurring every day, that's only the number we know. There is an element of how much we don't know. It's about 30 times that number. So a huge number is getting infected. And the best way to do is to step up on your effort at a level of personal protection. And that will pay dividends remarkably.
Behavior correction is the way forward from what you say. The key to recovery lies in how we practice it as individuals and how we incorporate it in the society. So the next question that I'm going to lead into is oxygen. Oxygen is an essential component of COVID-19 treatment. Now, could you please explain how and when it is used for treatment and why is there a shortage suddenly?
See, you have what is called as hypoxia in patients in COVID pneumonia. But the problem is if individuals on their own start diagnosing hypoxia with oximeter and decide to start themselves on oxygen, then that is a bit of a problem. Now, I'm not blaming people. I'm just saying that when you are anxious, when there's COVID around, people like to protect themselves. And that actually causes more problems. Now, oxygen should not be in short supply. And in fact, I didn't even know we were importing oxygen from other countries. I mean, it is not a commodity that we have made problem in. Many big institutions produce their own oxygen. They don't depend on anybody else. So I can't understand we got into this trouble, and that was poor management. But at this particular juncture, that is worsened by the fact individuals are storing oxygen for their kith and kin. People are stealing oxygen cylinders. This is all not a sign of a healthy society. And I think we are going back to the state of panic, which we had come out of it, and now we are adding to the confusion all around. People who need oxygen should be in a hospital bed, and they need expert care, how oxygen is delivered, in what manner, and somebody has to monitor. And we have the resources to do this. Here it looks like we are kind of out of control. But most sad was the stories about not allowing one district or one state to give oxygen to another, or not even one district to send across to the next district. I think that is not an acceptable behavior. When we are all in it together, and what you should incite now is not some sort of a petty, localized priority. We have to think in terms of caring concern for one another. I think that is where the good leadership will help a lot in terms of stimulating a wider, greater thinking of larger good for the whole community rather than protecting oneself and their family.
What might be useful for our listeners is to know at what point oxygen must be given. Now, we didn't face this situation earlier, and now there is a lot of talk about oxygen. So at what stage is it administered, and how critical is it in the treatment of COVID-19?
Well, in a hospital situation, you have a problem, especially if your oxygen saturation goes down. They measure oxygen saturation, and I think practically everybody has that machine that you can put on your finger and calculate, and it reads out the oxygen saturation. And below 87, should be started. Now, below 94, we are in a kind of a area of there is not enough really good oxygen supply. And the best way to overcome that difficult situation is when to in a prone position to breathe. And there are lots of information floating around how to do that. And from 94, it will smartly come up to about 97. And you are safe. And also your symptoms otherwise will suggest what you need. Now, the thing is, it has gone out of hand for some reason. And I'm not really sure why it has happened. Because people all have bought an oxygen measuring meter. They are measuring themselves, pulse oximeter, and self-administering oxygen is not a great idea. Okay, and I don't know how to react to it. Now, mind you, I'm not a clinician, and I know in our many cities where it's happening, there's no dearth of hospitals. But and after an experience with the disease for 1 year, we should be more competent in advising, managing patients. So I would like to go through a process of how individuals will be trained how to use oxygen. That is not a good idea. Okay, it has to have support of a doctor when the oxygen saturation is coming down. But just for general information, below 87, you are in trouble and you should be receiving oxygen.
Couple more questions coming up in this episode, Dr. Muliyil. Cases are predicted to rise and peak in May. What are the key measures taken by the hospitals to address these issues? Maybe you can speak about CMC Vellore. Are we geared to face this looming challenge?
I think one of the good things people have agreed upon is just because you're coronavirus positive, you don't need to get admitted, which is nice. Remember the earlier wave in the early days, we used to admit everybody. It was for the express reason of containing the disease. Containment is out of question. That word at the moment should be banned. Okay, protection from the virus individual level is fine. By containing by some government action or a police action is not an option at all. Now, treatment is needed only for people who are sick. Now, a large majority of persons do not even have any perceivable illness or will be a very mild symptom. Now, to know what it is, it depends on the state you live in. ICMR surveys show that for every case, there are probably about 30 other people who had corona infection. So by diagnosing a person with COVID positivity or RT-PCR positive, you don't achieve anything now. He's positive. That is it. The only thing we can say is probably he got an immunization. Our focus has to be on the small percentage who get into trouble. Now, 30 means one case, 30 unknown cases, which gives you a kind of odds of people becoming sick. So 1 in 31 will become sick, about 3% to 5%. They are the only ones who need the real care for the hospital situation. And so others can manage at home. You need to have transport communication so that people can be shifted to hospital if there is need. And if you look at the data from Tamil Nadu, actually the rise is sort of tapered off. I hope it's a good sign. These days you can't trust any information, any statistic. But if that is where it is, we will probably be able to manage. Like Vellore is a small town, but I suppose we attract a lot of patients from all over. And the hospital in Vellore, both government hospital and CMC Vellore and some other private hospitals are quite sufficient to handle sick people, but can't handle every RT-PCR positive or afford to have them in the ward. If you do that prioritization, we can manage all cases.
The last question in this episode that's come up from a few of our listeners is about reports suggesting positive results and outcomes from alternative medicines. For example, Ayurvedic tablets and immunity boosters. Dr. Muliyil, how effective are they in COVID-19 prevention and treatment?
I'm not an expert on this, and also I've not seen a single paper, scientific paper, that it works. So I cannot comment on it. There is a lot of problem about our own personal makeup. We trust in a lot of things. Our faith takes us all around the place. And for an individual, his or her faith is very valuable. And if they feel comfortable, I suppose it's okay. But I also worry that many of these initiatives are created by profit motive. And I hope everybody will have the ability to discern between this kind of a fake products and the real product. Because scientifically, you need to show evidence that these things work. And to my knowledge, not a single of these have had any proper study to show it works. Remember, in corona infection, majority, 95%, heal on their own. So you can give any stuff and say there is 95% effectiveness. That doesn't mean anything. That is the same as what you get in a placebo. So I would be reluctant to put my trust in these. So in general, anything that produces money, there's a way people market it. I think one should be cautious about it.
That brings us to the end of the first episode covering COVID-19 second wave causality, response and prevention. Do tune in to our second episode where Dr. Muliyil will answer questions about variants, tests and vaccines.